Okay, let's dive right into this explainer. Today, we're tackling one of the most absolutely critical challenges facing the modern world, which is measuring just how well our healthcare systems can withstand the mounting pressures of climate change. We all rely on hospitals and clinics when things go wrong, right? But how do we actually know if those very institutions are prepared to survive a rapidly changing environment? Well, that is exactly what we're going to unpack today by looking at the authoritative reporting standards that hold these places accountable.
So, to understand how we actually measure this resilience, we have to look at the gold standard for ESG disclosure, the SASB standards, which are now under the stewardship of the International Sustainability Standards Board, or ISSB, within the IFRS Foundation, provide a really rigorous framework for this. Now, these aren't just arbitrary, run-of-the-mill guidelines. They are the authoritative, industry-specific accounting standards that entities use to disclose their sustainability-related risks. Investors, regulators, they all use these metrics to gauge if a healthcare facility is genuinely prepared for the future.
The healthcare delivery industry, which basically owns and manages hospitals, clinics, and rehab centers, is in a really interesting spot. What makes the sector so unique, and frankly so vulnerable, is that it operates with incredibly high fixed facilities costs, and most importantly, highly vulnerable patient populations. Think about it. Hospitals are meant to be our safe harbors. If a severe storm hits or a massive heat wave strikes, people flock to these facilities. That means weatherproofing and climate resilience, they're not optional here. They are absolute urgent necessities to keep patient care running uninterrupted. Here is our roadmap for today. First, the climate change threat. Second, physical infrastructure risks. Third, changing disease profiles. Fourth, emergency preparedness plans. And finally, fifth, why resilience reporting matters. All right, kicking things off with Section 1, the climate change threat, and unpacking standard HC-DY 450A.1. So the specific standard we're looking at is HC-DY 450A.1. I know, the name is a bit of a mouthful, but it requires healthcare delivery entities to officially describe their policies and practices to address the risks associated with climate change. What I love about this is that it effectively transforms a dry regulatory concept into a literal, actionable survival guide for health institutions. It essentially asks healthcare leaders to formally document exactly how they are planning to protect both their physical assets and their human patients from unprecedented environmental shifts. Let's move on and see how this builds, because to comply with this standard, a healthcare entity has to report on 3 core pillars. First, how they address physical risks from extreme weather. Second, how they manage changes in illness and disease rates associated with climate change. And third, the robustness of their emergency preparedness and response. Basically, every strong disclosure strategy out there must cover all 3 of these bases thoroughly. Moving right along to Section 2, physical infrastructure risks, or securing the safe harbor. You really have to notice the stark contrast between the 2 major types of infrastructure vulnerabilities that these facilities face. On one hand, you've got geographical risks, like is the hospital physically located in a flood-prone, low-lying, or hurricane-prone area? That is a fundamental locational hazard. But then, on the flip side, you have facility design risks. Actually, think about this. Storing crucial multi-million-dollar medical equipment in basements where it can easily flood, or lacking sufficient backup power during grid failures. Those are massive design flaws. Administrators absolutely have to ask themselves and then report on where their specific vulnerabilities truly lie. Which brings us to Section 3, changing disease profiles and how the front lines are shifting. Now, the standard explicitly requires healthcare entities to describe how they are getting the necessary facilities and expertise to identify and treat changing disease profiles. Most critically here, hospitals must plan for added or flexible capacity. Imagine a completely unexpected extreme heat wave striking a region that is just entirely unused to those kinds of temperatures. The local hospital needs the immediate, flexible capacity to handle a sudden, massive influx of patients suffering from heat-related illnesses. And this table brilliantly illustrates exactly what we mean by changing disease profiles. It's kind of like a chain reaction. Vector-borne diseases like malaria and dengue fever, which typically just affect tropical populations, well, they may start targeting non-tropical regions in the future due to shifting climates. Then you have heat-related diseases, which include lung conditions and asthma, and those get exacerbated by increases in ground-level ozone. Also, increased flooding incidences lead directly to waterborne diseases like cholera, and decreased food availability that creates human developmental disorders like malnutrition.
healthcare providers absolutely must document how they're preparing to identify and treat these specific, evolving threats.
Okay, so we understand the physical risks, and we understand the evolving medical threats. This begs the ultimate question. When the worst actually happens, what is the plan? How does a massive, complex healthcare institution react to the unimaginable?
Let's get into Section 4, Emergency Preparedness Plans, Action and Response.
When it comes to documenting this preparedness, the standard requires a discussion of the regulatory environment in which the entity operates, specifically noting if local authorities already require specific emergency response plans. But listen, beyond just doing what is legally required, this is where healthcare facilities can truly prove their proactive readiness to investors and the public. They do this by disclosing if they have voluntarily implemented external policies or adopted recognized best practices to just stay ahead of the curve.
For example, the standard specifically cites the World Health Organization's Hospital Emergency Response Checklist. Forward-thinking hospitals are increasingly adopting comprehensive frameworks exactly like this one voluntarily. Disclosing the use of these internationally recognized checklists signals to stakeholders that the facility isn't just sitting around reacting to local mandates, but is actively deploying top-tier global strategies for emergency preparedness and response.
Finally, Section 5, Why Resilience Reporting Matters, the ultimate bottom line.
So the crucial point to take away here is that this kind of rigorous ESG compliance isn't just paperwork, and it's definitely not just about checking boxes for regulators. The SASB standards exist because these metrics are essential questions that both healthcare administrators and financial investors literally must be asking to prevent catastrophic failures. At the end of the day, it is about safeguarding human lives in their absolute most vulnerable moments, while simultaneously protecting massive capital investments from increasingly unpredictable environmental volatility.
We've covered a lot of ground today. We've seen how the standards require healthcare entities to look critically at their basements, their flexible bed capacity, and their emergency protocols. As the environment changes, the demands on our medical infrastructure are only going to grow more intense. So I want to leave you with this final thought to chew on. Based on these rigorous disclosure standards, is your local healthcare system truly prepared for the climate shift? Thank you so much for joining me for this explainer. Keep asking the tough questions and keep learning.